Good evening, everyone. Tonight we're going to discuss about hand washing and COVID-19 in part of our assignment in HPAD 201 under the topic of health and development. So we were tasked to read four journals. In these journals, it talks about the importance of hand washing in fighting COVID-19 and other factors that affects its transmission on countries with low socioeconomic status. Last 2019, the World Health Organization declared COVID-19 as pandemic, claiming lives even on the countries with advanced health system and technology. Although we know that the spread of infectious disease is all we need to do is to follow health protocols by hand washing, social distancing, and quarantining, those actions can't be done, especially on countries with low income. It was proven that hand washing with soap and water prevent the spread of COVID-19. Soap kills microbes by disrupting COVID-19 outer lipid layer, and running water flushes away viral fragments. So, even before COVID-19 pandemic, low socioeconomic countries already have scarcity on water. So how can they wash their hands to avoid COVID-19 when there is no water even before the COVID-19 pandemic? So aside from hand washing, we can prevent COVID-19 by social distancing and quarantining. But how will the low-income country do this? This again will make them more vulnerable to COVID-19. Low-income countries and communities usually have high index population. They live together in one household with a small space. So how can they quarantine the sick?
So to continue, we will explain the structural determinants that we have identified in the developing countries, which can be linked to the vulnerability of this population to COVID-19. So first, the poor socioeconomic status, as mentioned earlier, those in poor socioeconomic status had poor access to water, especially in the slum areas, wherein they have increased vulnerability to COVID-19 infection. And in these areas, they live in an overcrowded place and are exposed to people. Hence, they are exposed to communicable diseases, not just for COVID, but also to other diseases such as flu, viral flus, and also AGEs. And then second is the structural determinant that we have identified is the poor literacy. Despite having access to water, some areas have water. However, they do not practice hand washing. They do not believe in COVID. They do not know how to prevent COVID. That is why if they are not educated, even though they have full access to water, but they do not practice such behaviors, still we cannot prevent COVID-19 from transmission in these areas. Next slide. Another determinants that can be linked to the daily living conditions of this population is that first, these people living together in one household. So crowding prevents social distancing, which is an important strategy to prevent the spread of COVID-19. So how can we isolate or quarantine people if they live in one household? So if one gets symptomatic, we don't know if the government is not cannot accommodate also these patients. If our last resort is the household, how can we isolate or how can we quarantine them if in one household there's a lot of they have an extended family. So and then second is the sharing of water source. In their daily living condition, if they share a water source, they need to communicate with their neighbors. They need to share the same area. They need to share pathway when they go to the water source. Hence, they are not able to have social distancing in these areas. That is why this can be linked to the vulnerability of this population. Next.
So the next part would be to describe the relationship of the four determinants that we have identified. So we have identified actually four determinants, namely, we have the poor socioeconomic status, poor literacy, people living together in one household, and fourth is the sharing of water source. So these four determinants actually are referred to as our social determinants of health. So for the economic stability of the people, so we have said that poor socioeconomic status actually leads to poor access to water in the slum, which now increases the vulnerability of the people to COVID-19 infection. Another one would be the education of the people, which leads to our poor literacy. So due to poor literacy of the people, they do not practice this hand washing. Even though, let's say, they have access to water source, but then with their lack of knowledge on the importance of hand washing in the prevention of COVID-19, they do not practice it. Hence, again, their vulnerability uh, to COVID-19 infection. Next would be is the neighborhood and the built environment. So with the need of sharing of water source, like as explained a while ago, they need to go out and communicate with the people so that in accessing the water. So this would then leads to crowding, and then with crowding, it prevents social distancing. Hence again, the vulnerability of the people with COVID-19 infection. So another one would be the social and the community context. So the people living together in one household again, um, um, because there are too much crowding in the household, then again the social distancing is not being practiced. Hence the increased incidence of COVID-19. So therefore, the common denominator among these four social determinants of health is that there is a problem on how they control the spread of the COVID-19. Like as we have explained a while ago, it can be controlled through hand washing, social distancing, and of course the quarantine and isolation, of which overall there is a problem for the people with regards to their practice of hand washing. There is no social distancing, and of course they do not practice proper quarantine and isolation. Therefore, the people are at vulnerable of COVID-19 infection.
Okay. To sum it up, it was mentioned that COVID-19 infection can be prevented by hand washing, social distancing, and quarantining. However, in areas with low socioeconomic status, it was discussed that poor education, low socioeconomic stability, social and community context, and neighborhood and built environment, when they are poor, they can lead to more prone to COVID-19. Now, in low socioeconomic status, aside from those things, they also have poor access to healthcare. So they have really the low, they are really the most vulnerable to COVID-19 infection. So that's it for our topic today. Thank you, everyone.